Hello, I'm Robert Dempsey, and I'm giving an update on the COVID crisis, especially as it involves our Department of Neurosurgery, but also our place in society. I think that's very pertinent for a couple of reasons. One, it is, I believe, integrally related to the outbreak that we've had of great concern and protest regarding racism. It's very important about the economic problems that we face. And I believe strongly that it is very related that health, society are. I chose as the topic living with COVID because I think that's important. The realities of our present situation in our economic situation are such that we're going to have to understand that the lessons we learned at hospitals like the University of Wisconsin about how to control, to contain, to treat COVID, and indeed to avoid it are going to be important because we're going to be opening up even at a time when this is not defeated. I've been reflecting a lot on crisis and warfare and medicine, and it's always dangerous when people confuse warfare and medicine. And these images that COVID will be defeated or that it'll be vanquished or something of that nature is probably inaccurate. There may well be a vaccine and it may well come later this year, but our history of vaccines is much more spotty and unpredictable. And therefore, the lessons we've learned, which I can summarize pretty easily, wear a mask, wash your hands, and do not mass in large groups, are going to be probably more important. If there is a vaccine, I'd argue it will win the Nobel Prize, but I'd also argue it should win not for medicine because it's not very unique to make a vaccine, but for economics, because it could change the fate of our economic world. The situation with COVID is very, very interesting and still very severe. 8 million known cases in the world, 435,000 known deaths, vastly underestimated. The US is about a quarter of that. Given our population, that's greatly overrepresented. But the rest of the world is rapidly catching up. 2 million people in the United States have been known to be infected, 119,000 dead. Predictions of doubling that are seen. Yet, it's very important to understand that this is a hotspot disease, as many epidemics are. You can be living on a farm in Kansas and be led to believe that this is a hoax because you don't see it around you. Your associates do not mass together. They do not travel from New York and Milan very frequently. They don't see the disease. And Dane County has really not been massively affected. We have a steady state of cases, which unfortunately are beginning to fall. The nation is beginning to fall, but not in hotspots. 20 of our states are showing an increase in cases. Countries that ignored this, like Sweden and Brazil, are gradually increasing and rather rapidly. Countries that tried their best with the system they had, like Peru, India, are increasing. And we begin to understand what we did to totally shut down a society and the impact, you understand that's not sustainable. We have to reopen. We cannot not have farms. We cannot not have healthcare. People being afraid to go to see their healthcare greatly increased the death rates during these last 4 months because of strokes, untreated cancers, untreated head injuries, children whose sniffles were ignored till they became brain abscesses. We cannot have that. We have to learn to live with this disease so we can do healthcare and other essential services, which need to be broadly defined. I think a really good example of that is when you look, as the epidemiologists do, at a disease like COVID. They don't just count cases because, of course, we only know about the cases where people are tested frequently. We can count deaths, but the actual diagnosis, especially in many countries that try to underestimate their number of COVID cases, They only report those that are autopsy proven, which we know is a tiny, tiny number. What the epidemiologists do is they look at the increase in deaths during the month in the city that they're studying compared to that month in every other year. There are examples of this. If you remember the summer when there were so many gang shootings in Chicago, well, that made a lot of news, but it only increased the death rate for Chicago for that month by 1%, which is trivial. Indeed, a bad flu outbreak in a city might increase the death rate by 5%. That's something, but it's not that very high. If you look at what happened throughout the world, Jakarta, Recife, Rio de Janeiro, their death rates increased in March by 1.5. And that's really dramatic. That's what a hurricane does to an area of Puerto Rico when Hurricane Maria hit it. That's what the AIDS crisis did. That's what these massive heat waves that hit the Midwest a few years ago with all the elders dying in a month. That's what that was for that city. But that only really is the tip of the iceberg. If you think about past disasters, such as Hurricane Katrina, that increased the death rate in New Orleans by 2.5 times. That was world news. It changed the presidency, it changed the country, and yet that's exactly the death rates that we saw in Boston, in Paris, and in rural Brazil in the last month. So this is a major event if it is allowed to become a hotspot. It actually is worse. In London and in the Catalonian region of Spain, it was 3 times the death rate in that month. Nothing does that besides war. The only comparable infection that ever came close, because no natural disaster has done that, was the 1918 flu epidemic. That may have killed 100 million people. And so the lessons we've learned since then, including lessons we learned this week, a drug that we use commonly in neurosurgery to decrease inflammation may be important for key patients, not everybody, but key patients who are having this cytokine storm we talked about, which causes the respiratory deaths and probably a lot of the vascular complications, strokes, heart attacks. So the scientists are helping and we're learning. But we cannot tolerate a completely closed society because when that happens comes recession, depression, famine, and war. And a small taste of that is just the unrest and the protest movements which are now going on worldwide in a very uneasy society. So we must reopen. How do we do that? And what did we learn from months of isolation and hospitalization? Well, that we can do it safely. And what we've done in this hospital is reopen the operating rooms to about 91% of capacity. Now, that's not only because we're slow getting things together, getting staff together, but also because patients are not seeing their doctors at the regular rate. Diseases are coming too late. We have to change that, which means we must reopen the clinics. Now, the neurosurgery clinics are about 90% open, but one clinic is not as yet. And we are seeing people, often with telemedicine, as rapidly as possible, but our volumes are still not quite as a department where we would like to be. We know that our family medicine colleagues are reopening across the summer, hoping to reach 80 to 90% of capacity at end of summer. I know that many of us are unable to see our family practice doctors right now. That has to change because without that, cancers won't be treated, prenatal care won't be given, strokes won't be avoided. The offices and students are a fascinating issue. Just minutes ago, the chancellor released the plan for the university for students. And this, I predict, will be mirrored over the next weeks for university employees. And that is an attempt to be fully open in September. And they're going to do it by, just as we predicted, Small groups will be taught in person, but they will be done in large rooms, so be socially distanced. Masks will be required, and hands will need to be washed. Large groups, large lectures will be done virtually. And I believe that that will mirror what tells us exactly as we predicted what will be happening to office staff, etc. It will take all summer, but we will gradually reestablish with staggered schedules, a considerable amount of online meetings and work, but we'll be present more in the buildings, and that will come. The students will return in the med school in a staggered fashion. I last 2 weeks ago said it'll be 3 months. I believe that's true. We already have the fourth year students who are doing their rotations to try to see about their residency interviews, etc. That will be coming on. And that's important, but it's also extremely slow process, and it's iterative, and it takes time. The labs are open. We now have permission to start to get IRB permission for our clinical research. We will provide masks, we will provide face shields, but face-to-face interactions will be starting slowly. Some of our major projects, like with the Oneida Nation in clinical research, are going to take a concomitant comfort level in the United Nations themselves, so that'll come slower. And I'm making every attempt to try to normalize the education process. Today was our first virtual visiting professor. It went very well. It's different, it's not ideal, but we can learn a lot. So we're going to be opening up some of our named visiting professor programs to the virtual professor program, both in the research professors and the clinical professors. Our graduation on Friday will be virtual, will be online, and the department awards will be given, and I invite everyone to tune in. Invitations should have been received. It's the first time we've done it. Your participation will be appreciated, and I know it'll be appreciated by the people who are receiving recognition awards and graduation. There are important factors about furloughs, etc., which have ended. I'm sorry, which will be the furloughs are with the school and will be over the course of the next 6 months. But the pay cuts and the flexing is at least at the present time ended as we try to close out the year. I think that's important if you want to understand why travel has been cut and why I believe it'll be limited for a while, is to understand the effect on society as a microcosm is the effect on UW Health of COVID and of closing. When we closed, we basically saw a non-paper loss of about $400 million. That includes lost investments, which meant the capital projects planned for years for UW Health are totally on hold. Just making the payroll, just making ends meet, we were probably 130 million short. We did get a government loan of about 50 million, which has been helpful, but the rest of the shortfall is made up by decreasing expenses and increasing revenue. Decreasing expenses is mostly payroll. You can only save so much money by turning off the heat in a building, etc. And so that was the furloughs and flexes that took place and the donation of salaries back. That helped greatly, but also departments like neurosurgery continuing to work and even increasing work with the stroke and tumor patients and trauma patients, which are always there, has gradually brought us back. The UW Health is probably going to end the year with a much, much smaller loss, which means that their bond covenants will be in place, that they will keep our doors open, and the Department of Neurosurgery is going to be all right, probably by midsummer. We've been doing so much work that our amount of work will look a lot like last year. Not the increased rates we were doing during the winter, but on average, averaging out to being good. That's important because a lot of our work and the spin-off from our work is what keeps UW Health going, allows them to establish the margin they need for bonds for keeping people employed. Nevertheless, the next year is an unknown. And the reason is because in a recession, people can't pay their bills. I mean, if you have people off work, after a while, the employers will not be able to pay them. They won't be able to buy things. They won't be able to buy things as other people start work, and that's how recessions happen. You're going to learn about a term in the next year called payer mix, which means that we may do a lot of work, but we may not be paid. Now, frankly, I'm okay with that. I come from a culture where I did a lot of work without being paid, and that's fine. But it is hard to pay the bills, keep the lights on, and we're going to have to be extremely frugal. And we're going to have to work our way through because it's directly related, I believe. Infection brings deaths, brings infection rates, but that increased death rate had to do with the spin-off of COVID and the spin-off of being unemployed or being afraid to see your doctor or being depressed. All that counts. Well, within our future of the next year, we're going to be going month by month to see what we can afford and where we're going to have pay. Most of my commitment is to keep the staff and employees going. And indeed, yes, the faculty may be paid less than they were the year before. We don't know until we see, but we're prepared. And all faculty throughout UW Health will be doing a withhold. That is, they will be withholding a percentage of their salary for this coming year for that rainy day, because it is raining now. And we'll have to see how the year ends out. If we're able to recover quickly, things will be fine. I don't see the vaccine coming that quickly. Therefore, we will be living with COVID, and our society will. And the key is we have to model the behavior, mask, wash your hands, and don't mask together, that will allow Dane County to survive, build up, not shut down, and not overwhelm our hospital with COVID patients so we can take care of our base patients, the brain tumors, the strokes, the congenital deformities of children, etc. I believe strongly that all of this fear that causes people not to see their doctors, is the same fear that brings out violence, that brings out racism, that brings out protest responses to racism, appropriate as they may be. Um, and I've been reflecting a lot about crises, and I've been reflecting about Abraham Lincoln because yesterday is the anniversary, 1858, when Lincoln stood up in the Illinois House and gave his House Divided speech. House divided on itself cannot stand. He was, of course, quoting the Bible. Both Mark and Luke quote that. And he was bringing the point home that we must be one people. And I think that's really very, very important. And you must stop and think, well, gee, that's a police problem or a government problem. I'm in healthcare. Well, I believe strongly that healthcare could be the leader in this by modeling the appropriate behavior. Because what really brings about these inequalities in our society? Well, I'd argue it starts with lack of good prenatal care. If a baby's born in a society they don't have a chance for good brain development or good health, that's that's what is the basis of these discrepancies, these inequalities. We need to be the leaders in this. Lincoln's better quote, in my opinion, was, if you can tell me, I'm sorry, he said, you can tell the quality of a person by what makes them angry. And I'm angry about the inequality in healthcare because that's what I do and that's what we do, and we do it well, and it has to be well distributed. We have to stand for that, that access to education and healthcare is the way we build our way out of these inequalities. We have to have equal access, equal insurance, and we have to renounce racism just as we renounce violence. Embrace what we do well, persevere. When there's a crisis, what we do is we persevere. We can do this because we can be the shining light that shows people that this idea of imaginary differences between people, imaginary differences of quality based on color, religion, size, tribe, gang, are nonsense. There is no other. Um, Again, quoting Lincoln. Lincoln once said, "I don't like that man. I must get to know him better." I think he was very wise um, because we're in a position to use our science to make the world safer for people in this COVID crisis. But really, that's what we do every day. And what we do is we embrace every part of the healthcare system and we make sure it works. Neurosurgery has been very good at that, sometimes financially, sometimes as a keystone in trauma, critical care. We persevere and we sustain. And if we do that together, we'll be okay um, because it's the principles we stand for. Um, Lincoln's final quote for today was a good one. He said, "Whatever you are, be a good one." So we are in the midst of the COVID crisis. It will go on for some time. I believe we will live with it, and that will be the way we will succeed. We will get on with lives with very important changes in that make it safer. They're modeled here, and that's the way we model society. I was able to participate with the medical students in the White Coats for Black Lives demonstration Saturday, and I'm very proud of the medical students because I think they will lead us. So I don't want anybody to be afraid. Appropriately concerned, but don't be afraid. The COVID crisis is with us. We will be stronger for it. We will live with it, and we will get past it. Either it will die out or we will have that vaccine, or we'll cause it to die out by appropriate spacing, masking, and hand washing. It's an exciting time. I'll try to keep people informed, but I'll probably do these maybe every other week or so or as needed. Thank you very much. I'd be happy to answer any questions that people have. And please, since I'm not very good at the chat box, just speak up. Be happy to answer questions, especially about the university's process of reopening, which I think we predicted exactly. And I also think we can predict the economic forces that are going to be driving the next few months. Thanks very much. And thanks for all that you do.